Hey everyone, Dr. Dahl here. I really appreciate the fact that you're taking the time out of your, I'm sure, busy weekly schedules to spend hopefully no more than an hour with me in conversation of our next course lecture topic for this week. As I've mentioned, and as you likely already know, we sort of got a hiatus from class this Tuesday as I'll be off campus. And so, in place of that, we've got a recorded lecture coming up relative to the topic of policy making, specifically looking more so and a lot more in depth at the policy process and perspectives on the policy process. So, I'm excited to take the next hour or so and chat with you about what that process looks like in quite a bit more detail than what we have thus far throughout the last few weeks of our work with the policy making process. So, let's go ahead and jump in and get started. So first things first, I just wanted to cover some quick announcements. I'm not sure if my black bar as I'm recording is in your way, so I might move this every once in a while to make sure that I'm not blocking any of the important stuff you need. So as I mentioned, of course, today's class, or what would be today's class on Tuesday, has been canceled. In place, you're listening to this recorded lecture at some point this week, hopefully in advance of our time back together when I join back with you on campus next Tuesday. I did want to remind you, though, that the only actually canceled class is, in fact, Tuesday's class. We do have class on Thursday. Actually, Dr. Bry, who all of you know very well and love her like a second mother, she will be with you during normal class time to take attendance and kind of just provide oversight during the class period. But otherwise, you're going to be given the entire day to work on a number of different things that you have going on relative to class. That could be your first advocacy activity, which we talked about last week before we parted ways. And as you know, there's quite a bit of work to be done on that assignment. So you could be using your time to work on your advocacy activity. You could be also working on your questions for District Representative Pierce, who will be joining us by Zoom when we join back together. I will go over the details of that particular assignment again here in just a moment in case you weren't here in class last week. And then, of course, you have your study guide that you could be working on in preparation for the exam that we have the week that we return. And so you have a lot of things going on. I want you to use the time to the best of your ability. I know you're busy, and so why not make use of the hour and 15 that we would normally use for class to get some things done. So make sure that you bring any work materials with you. As mentioned, Dr. Bry will just quickly take attendance, and then she'll give you as much time as you need to work throughout the entire course of the class period. When we return together, which will be Tuesday, February 13th, I just wanted to give you a reminder that it's a very important day to be in class because we will have a guest speaker with us. As I'll talk about in a moment, we have District Representative Kyle Pierce connecting with us through Zoom. And then Thursday of that week, we'll actually be taking part in our first and really our only exam for this class, covering all the concepts, terms, vocab, and ideas that we've discussed so far this semester. Keep in mind that I have posted a study guide relative to exam one to our course Canvas page. So I would definitely make use of that study guide so that you're not reviewing more than what you need to be for the test. My promise is always, if it's not on the study guide, it's not on the test. And so if you take the time to complete the study guide, you should be in a pretty good position to be really well prepared for the exam next week. Just as a reminder, the exam doesn't feature any open-ended questions. There's all multiple choice, true, false, matching, fill in the blank questions. It's something we will complete during the normal class period. So you'll be given the entire hour and 15 minutes on Thursday, the 15th, to sit in class and complete the exam. I did want to let you know, because you have your advocacy activity due soon, we've got the work with Representative Pierce, you're working on your study guide, that if you do have any questions, you need some extra insight, you don't know where to find some information that you need, I am absolutely available by email this week. And so even though I'm not on campus, I am definitely reachable. It may take me just a little bit longer to respond because I have quite a bit going on this week, but I will do my absolute best every day to check my email at least once and respond to you with anything that you may need. So please don't feel like you're stuck out on an island. I'm absolutely here to help with whatever you need as you're preparing for our very busy week when we return next week. So just as a reminder, when we come back together next Tuesday, if you weren't in class last week, you might have missed a little bit of the detail of this announcement. But we will have a guest speaker connecting with us through Zoom. Unfortunately, State Rep Pierce wasn't able to attend in class at the time at which we were having class and when I really needed him to present. And so we're going to be connecting through a Zoom conversation. Just as a reminder, Kyle Pierce is our speaker. He serves as Indiana House of Representatives, District Representative in District 36, which is really encompassing the entirety of the Anderson area. He was elected into that position in 2022 and still serves in that role. Kyle is actually a BSU alumni from the Political Science Department. He also received his Juris Doctorate in Law from IU School of Law. And he also sort of hails from this part of the state as well. So he's really well connected to what's going on in East Central Indiana. State District Representative, State Rep Pierce, also serves on a number of committees that could be relevant places to consider when you're coming up with your question. He serves on the Commerce, Small Business, and Economic Development Committee, on the Elections and Apportionment Committee, and also on our Financial Institutions Committee. As you'll see at the bottom of the screen, he also has been involved in authoring or co-authoring a number of bills that are on the current legislative agenda for 2024. You'll see that a number of these feature topics that are connected to health, ranging from consumer genetic testing to crimes that involve fraud, which sometimes are connected to Medicare and Medicaid fraud, gun storage expenses, which could be connected to topics of gun violence, which is clearly a public health issue, trafficking of harmful substances in jails. And so while his committee involvement isn't inherently connected to health, he is very closely connected to a number of public health initiatives through bills that he's either authored or co-authored. So you could check out these specific bills on the Legislative Assembly website that we've looked at in class to get some more detail. You can also use the web link that I provided on the screen to actually go into State Rep Pierce's specific website, which discusses his involvement with a bit more detail than what I have here. So what I need for you to do is to review some of this relevant legislation and submit a question that you would like me to ask State Rep Pierce in his Zoom conversation with us that Tuesday. Rather than writing it and bringing it to class, and largely because we're connecting with him through Zoom, I'd ask that you submit to the discussion board so that I can print these out and have them ready to be asked before class on Tuesday. Ultimately, with a Zoom connection, it's really hard, and I've learned through some poor Zoom issues in the past, it's hard to figure out audio sometimes with a Zoom connection. And it might be easier if I have the questions and can be by my computer to ask him the questions you all have, rather than trying to move the computer around to all of you in the classroom if the mic isn't working in the classroom. So it would be really, really helpful for me if you would just submit them to the Canvas discussion board. I'll be choosing as many of these as I can, trying to, not repeat them or anything, but choosing as many as possible to discuss during our conversation. And you will get points on your exam 1 for the question you submit for this particular speaker. So as you know, this is a pretty weighty exam worth a lot of points, and a portion of the points will be connected to the fact that you submitted a question for State Rep Pierce to that Canvas discussion board. Obviously, that's 2 days before the exam, but it'll count into exam grades. So while it doesn't have a unique point value, it is included within your exam grade. So it's something you don't want to forget to do. I'm really excited to see what kinds of questions you come up with for State Rep Pierce. Like I said, connected to his specific public policies, or maybe you just want to learn about the legislative policy process more generally. There are a number of things that you could ask him about his work in the Anderson area. So I look forward to seeing what kinds of questions you have, and I look forward to our conversation with Kyle Pierce when we return on Tuesday the 13th. I also wanted to start off today with a quick discussion of your next advocacy activity. Now, don't get confused here, because I did talk about advocacy activity number 1, which is due when we come back. But there's another advocacy activity with a deadline of mid-March that I wanted to put on your agenda earlier rather than later, just because it's going to require some scheduling outside of class. So advocacy activity 2, as mentioned, isn't due until Tuesday, March 14th. which is after you get back from spring break. So we've got quite a bit of time before this activity is due. Activity 1, again, due when we get back from our time away now, but this one not due until the middle of March. Advocacy activity 2 is to encourage you to get a chance to experience real community decision-making in action. And so I'm going to be asking you to find some sort of governing organization in your hometown or in the local Muncie area. So I don't care if you're from Indy and you're heading back to Indy, if you're spending time there over spring break or wherever your hometown might be, or if you just want to pick an organization in Muncie because that's where you spend most of your time. The organization and location is really non-preferential to me. I'm going to ask you to actually attend one of their meetings. And then following that meeting, craft a short, like 1 to 2 page typed double-spaced reflection, answering some questions on what you learned in taking part. So if you're heading back to your local community, you might be looking for your city or town council meeting. Any of those would be fitting for the context of this assignment. Otherwise, if that doesn't fit your schedule, there are a number of neighborhood association meetings that you might consider attending. Here in Muncie, that could include taking part in the Muncie City Council meetings, which takes place once a month, the first Monday of each month at 7 p.m. at the Muncie City Hall Auditorium downtown. So if Monday evenings are fitting from you and you're going to be in Muncie on that first Monday of the month, which I will say actually falls, I believe, on spring break week. So not the most convenient unless you're planning to stay in Muncie for spring break. You could attend the Muncie City Council meeting. Otherwise, Muncie has a number of local neighborhood associations that all have individual meetings for each of those neighborhood associations that you could attend. I know, because I've attended a number of them, that the Whiteley community in Muncie has a very active neighborhood association that meets the second Monday of each month at Union Missionary Baptist Church at 6 o'clock. And so that is one that would still be within the frame of the deadline for the assignment, but not be during spring break week. So you could follow their website on Facebook. I've linked that or provided that to you here just to get updates on if the meeting is happening in person or they shift sometimes to virtual. But I would need you to attend in whatever modality to use for the purpose of this assignment. If neither Muncie City Council or maybe even the Whiteley community meeting fits for you, as I said, remember that every single community across the state of Indiana has a city council and they have monthly meetings. So you may just need to look into that using your good web search skills to figure out the schedule of whatever city council makes the most sense for you to attend. After you take part in that meeting, so you're just going to sit in and listen, I'd like for you to respond to the questions that you see on the screen in your reflection. That includes talking a bit about where you went and what was the date, time, and location of the meeting where you attended. So just some basic details in your introduction. I want to know what local community leaders were present at the meeting, and if you could give me their names, or if you don't have their exact names, if you could give me the general title of the kind of people that were present, that would be helpful. And then I want you to take some time to summarize the business that was discussed at the meeting. Now, I don't expect a line by line set of minutes, but if you could provide a summary of if any new policies were introduced or passed, and how that took place. Did they have a special vote? Was it voted in? Was there discussion? Kind of what was the result of the policy discussion that took place? Were there any topics that may be perfectly or tangentially related to health in some way? And if so, how were they approached? What was the discussion? Also, were there any community members who weren't a part of the town council or the city council presenting new issues at the meeting? So did something come up from the community that wasn't on the pre-existing agenda? And if so, what was that conversation? So that's just going to require you to be an active listener during the time you're taking part and sort of responding to what happened during the time when you were there, with a special focus on policies and health-related topics. And then at the very end, I would like you to consider at least one lesson that you could take into your work as an advocate for public health or for systems change, sort of something you learned from the meeting that might give you insight into how to be a better policymaker or be a better advocate. And the point here is to apply that lesson. How would you go about using what you've learned in your continued work as a policymaker? Now, this doesn't inherently have to do anything with the content or topics of the discussion. You may just learn a little bit about community dynamics and how people work together. And that could be a very good lesson for something you'll need to know if you were ever to attend a future meeting and want to bring up a new policy. So just keep in mind that lesson can be broad or very specific, but I want to see how you might use what you've learned in your future work as an advocate. So the assignment, attending a meeting, reflecting on it, is due by Tuesday, March 14th to Canvas by 11:59 p.m. that night. We'll talk about this again when we return back together, but I did want to put it on your agenda just because these are meetings that take place outside of class. So I know y'all have busy schedules, and hopefully you'll be able to find the time to attend one that makes good sense for you. So with that being said, I think all my announcements are finished. I wanted to transition to our lecture topic for today, which is to talk a bit about the policymaking process. Now, I know that I've given you over the last few weeks a lot of terminology and detail into how laws and policies are passed and the important parties that are involved in all of those pieces. When I think about policy making and I try to translate it into the way in which I'm approaching it with all of you, I look at it as some of the work similar to some of the work that I'm doing with my 12-year-old son, Gabe, trying to help facilitate his passion in creating hot sauce. Now, if you know me, you probably would learn quickly that I am not a fan of hot things at all. I hate spicy food. It's not my deal. I always get heartburn. But somehow my son was born with a love for cooking and a love for spicy food. So this past Christmas, we found a hot sauce making kit that we thought would be really interesting for Gabe to play with and learn how to make his own homemade hot sauces. And so I've been trying to help him through the process of learning what it takes, the ingredients and how you put things together, and what is the process of making something that you could potentially be giving to other people to consume and how to do so safely. How does this relate to our work with policy making? Well, I feel like the last few weeks I've given you all the ingredients of your hot sauce, right? We've talked about the terms and the concepts, and you're understanding sort of what you need to put into the pan to make your own advocacy or policy hot sauce. What I haven't yet walked you through is how to go about doing that work. So you know what goes in the pan, but do you know how to cook it? Do you know how to blend it? Do you know how to put it in the bottle and sell it to the person that you want to sell it to? I've given you the ingredients to the recipe, but I haven't given you the tools and the directions for how to go about putting it all together into that process. And so my goal for today is to walk you through the details of the policy making cycle or the policy making process. There are some very distinct stages, regardless of your health topic, that we want to follow. If you were sort of thinking that you might have some sort of issue worthy of policy change. And my goal for you today is to help you take all of the ingredients that I've given you the last few weeks, just like I've helped Gabe with his hot sauce, and put them together into a really good pot of policy hot sauce that you can hopefully take out and use after your time with this class. So we're going to take some time for the rest of today and walk our way through each of these steps in the policy making process. So the first step in the policy making process is defining the problem of focus. Now, I know that I've given you all the opportunity to think about your specific policy topics. And so for all of you, you're sort of at the point where you're already almost past step one, and that you've identified a policy that you feel pretty strongly about. However, when you're out engaging as a professional, you'll probably be in situations where you aren't necessarily handed a policy. It's upon you to figure out what the problems are that could be deserving of a policy or a systems change. And so how do you go about doing that? Well, I think one of the first questions, and is advocated in your textbook reading, is that you have to take a moment to really consider if your solution and your problem are really best served by policy versus some other initiative. One of the best ways to consider whether your issue is a policy one is to ask if the problem affects more than one person, or is it just unique to one person? Now, my rejoinder to you is that it doesn't mean that if something is happening to one person, it couldn't be a policy initiative, but it would likely take more people than just one person's experience of a problem to push for change in the way that systems change often does. Usually, if it's one person's problem, it could potentially involve just simple consultation with that person to help solve their issue. But if you've got a problem that a lot of people are experiencing, then obviously it could be a place for policy or systems change to take place. Another question you might ask is if the problem is caused by the person's circumstances, or is it caused by an institutional issue or a policy that's been currently enacted that's not serving a person or persons in the way that they should be? Or is it a systems or a structural barrier that's keeping someone from engaging, right, in a certain kind of way? I might have a person who is facing some really serious difficulty getting access to a service. But when I actually learn from that person that it's their own hesitancy to get the service, or maybe they need help with transportation to get the service that other people have that they just have been lacking, it's not really a policy change I need. It's an intervention with just that one person. But if someone needs transportation and there are no adaptations for people in a similar situation, then yeah, maybe there is some reason to make an argument that the institutional change should take place. So you have to be careful to think, is this caused by just one person's circumstances, or is this really something where there's a structural policy problem that needs changed? And last but not least, and probably the most important, is that you have to consider whether or not there are actual solutions to the problems you hypothesize. There are a number of issues that are necessary of policy change out there. I mean, look at the legislative agenda at any time, and we could find a whole bevy of problems. The issue becomes if there's really a good policy solution for the problems that we have. And unfortunately, there are some issues definitely in need of change, but we just don't have a good solution relative to a new or change in policy that would potentially take care of that problem. So it's super important to ask yourself, does the problem have a direct policy solution? And if it does, it might be a place for actual policy change. So just as an example, I'm going to run through a few different sort of scenarios with each of these steps today, and I'm going to try to connect them back to one central interesting initiative that actually was put on my plate by one of my former students. Many of you probably know that Ball State has a food pantry for students. It's called Cardinal Kitchen. I've included one of their more recent flyers from fall 2023 discussing where it's at and how to contact them and the dates and the times where they are open. One thing you might not know, if you have or have not, I guess, received the services, is that Cardinal Kitchen isn't open a whole lot. Really, as you can see with the dates and times listed, we only have a few dates a month where Cardinal Kitchen is actually open. And I had a student engage with me last semester who said, I'm a food insecure student and I could really use the services of Cardinal Kitchen, but I don't have the ability to attend at the times that they're open. And I wonder if there are other students, apart from just me, who are turned away from Cardinal Kitchen because of the accessibility in the number of hours. Do you know why it's only open one day? Do you know why it's only open for 3 days a month? And so we sort of started asking some questions about what was going on with Cardinal Kitchen. And I found in talking to that one student that there were actually a number of students who were expressing some hesitancy and some disagreement with the schedule of Cardinal Kitchen. Many of them, it wasn't necessarily an issue of their own scheduling because they had a variety of schedules. It was more so caused by the limited number of hours that the organization had decided to be open. And I thought to myself, maybe this is a place where we could see some institutional change. And so I decided to investigate with a little more detail exactly why Cardinal Kitchen had the limited hours that it had, and what it was doing to really market itself to the broader Ball State community, out of the premise that potentially there could be a place for policy change if I found the right answers. So I'm going to talk to you a little bit about that effort throughout our conversation today. And I will tell you, I don't know how much you all have seen of other students experiencing food security, but on this campus, we have a significant number of students, almost half of our students, 47%, who have reported at some point they've experienced some level of food insecurity, which is a really shocking statistic that half of our students are facing a lack of consistent access to the food that they need to feel nourished and healthy and be good students here at Ball State. So for me, it was a clear answer to the question of, does it affect more than one person? Absolutely. It affects half of our campus, the problem itself. Now, whether or not those students are accessing Cardinal Kitchen becomes the real question. And that's one of the problems that I sought out to address in my work with this student and Cardinal Kitchen. So we'll talk about that in and out of the rest of our conversation. The second step in the policy process is called agenda setting. Now, this is a concept we're going to talk about quite a bit later in the semester when we get to the conversation of media advocacy. But it really is well situated in our early part of the semester as we talk about the steps in policy making. Now, one of the most important things you're going to have to do is to take this issue where you think policy change is relevant and find a way to put it on the policy agenda with the right organization at the right time, which may sound simple, but can often be a very difficult task. How do you take your singular passion in this policy change that's affecting these people and get it to the place where it needs to be for actual change to happen? Ultimately, one of the most important points in setting the agenda is that you have to find enough people who think the issue is important and worthy of change, who feel as though the current status quo is unacceptable, for you to be able to push your policy forward. If you don't have enough people and it's just you on a sort of singular path towards change, sometimes that can be very difficult to move the issue forward on the agenda. So when we start talking about creating coalitions and finding partners, it's all relevant at this stage of agenda setting. As I mentioned in the last step, we already need to have a solution that's sort of readily available to solve the problem. A solution that is reasonable, that has not too much of a cost, that is going to actually address the problem. It's great to have problems, but it's not likely going to move into the policy agenda if we don't have some sort of solution that we can advocate. And last but not least, and potentially of the more important, other problems need to not have higher agenda on the or higher priority on the agenda at that time. So your issue needs to be the one that actually is at the top to be considered, because we know the legislative calendar is limited. And so even if it makes its way onto the agenda, it needs to be at a place of higher priority to ensure that it's getting its rightful discussion. So when we're thinking about this topic of food insecurity and how we might go about advocating for a change in Cardinal Kitchen support, we have to ask ourselves the question, how do we make food insecurity on the agenda at Ball State University? And one of the most important parts of that conversation is, where is it in the priority list compared to all the other health issues that Ball State is experiencing? How does hunger compare to other campus health issues? Because we don't have innumerable resources, we don't have all the time in the world, so we have to consider what else is on the agenda. Now, I can tell you, likely is the case in my conversation with Destiny Cherry, who is our campus wellness and health educator, that there are many other issues on the agenda than just hunger. And we have to concern our effort towards finding a way to push hunger higher on that agenda. You know, I pulled some report graphics for you from the most recent American College Health Association report. And this data connects to one of the most significant competing priorities at the college level, which is alcohol and cannabis consumption, people smoking pot and drinking. And you can see that just in the figures of the number of individuals who drink alcohol, half of our students on campus are consuming alcohol at a pretty frequent percentage. We had about 51% at some point in the last 2 weeks. And we had a relatively high number of students who are also consuming marijuana or cannabis. We had about 20% within the last 2 weeks. Ultimately, when you ask questions about how is that presenting a risk, not just to the user, but to the people around them, one of the more startling statistics we saw from the recent report was that we had 40%, 41.4%, where that arrow is marked, reported that they had been driving within 6 hours of using cannabis or marijuana, 20% after alcohol, which is, a problem in and of itself, but almost half of our cannabis users are smoking pot and then getting in the car. And that can be a really, really risky thing to do. Ultimately, the second graphic is sort of showing you the number of students who reported experiencing some sort of horrible effects and problematic drinking behaviors, not just casual drinking. And you can see some of these figures aren't particularly small. 20% of our drinkers on campus had browned out, which is a little different than blackout. It simply means that you're sort of forgetting what you did for a short period of time, and then somebody reminds you, and then you remember. So we have a significant number of students who, when they drink, are having some situations where they're not remembering what they've done for a bit. And we have 12% of those users who have had unprotected sex while they're drinking or after an instance of heavy drinking. And so it would be easy if hunger was the only health issue on the agenda. But we know at the college level, there are lots of other health problems. And so we have to find a way to put hunger on the agenda so that it's in a place of discussion and focus, which can be quite an effort. So relative to that question of getting something on the agenda, I wanted to talk for just a quick moment about one of the most commonly studied models in application towards finding the right moment to put something on the agenda. It comes from a scholar, Kingdon, who sort of created what he called the policy streams model. In this model, he argues that we have three different streams that are all kind of ever flowing when it comes to the time at which a policy could be implemented. And we need to wait for the point at which all three of these streams are overlapping at the perfect time for us to really have an open policy window to encourage policy change. So once our problem stream, our policy stream, and our politics stream come together, it means that there's the perfect time for us to go about putting our policy on the agenda. And if we try to do it at other times where they're separate or they're divergent, it's probably not going to be successful. Now, what do I mean by the problem stream? Well, that means we need to find the time where the problem that's in need of the policy is significant enough. If it's not a big problem at a certain point in time, it might not find its way onto the agenda. So we need to look for the right time where the problem is really serious. The policy stream is relative to the solutions. So the acceptability, costs, and capacity for the policy change or initiative is all just right. Even if our problem is really significant, if our policy change is going to be really expensive at that time, or people aren't going to approve of it, or we don't have the right kind of personnel to regulate the policy, unfortunately, it might not be the right policy window. So we've got to have enough of a problem with a fitting solution. And then potentially, it's sometimes just as important is our politics stream. We need to have the right leadership involved. We need to ensure we have the right support from the community. Maybe it's waiting on a certain set of election results where a certain party is going to be in office who's most supportive of our initiative than the other party has been. It's sort of like finding the perfect time at which the problem matters enough, the solution is going to really make sense, and you've got the right people in charge, the correct leadership, that the window opens up and now it's perfect time to push your policy through. That's really what Kingdon's model of policy streams is all about, is finding that perfect policy window. Now, I will tell you that there are times where we might get lucky, and I hate to use the word lucky because really these situations are not lucky situations. What I mean by lucky in this sense is that there might be times where we don't have to perfectly wait for the window to open up. These don't happen often, but they can happen. They're called focusing events, and that's a term I want you to remember. Focusing events are events that are relatively sudden and unexpected. They're rare, and they're attention grabbing enough that they can act as triggers for policy change. Even when we might not have perfect overlap between the three streams in our policy, politics, and problem streams, we might have a focusing event that just creates an opportunity for us to insert our agenda. One example of this relative to reproductive rights took place, a few years ago. We saw some real challenges to global reproductive rights. You may not know that there are a number of other countries across the globe who face similar challenges and passed similar policy to the United States in limiting reproductive rights in the last few years. One of them was Ireland. Ireland decided to sort of uproot its abortion policy And very similar to our work with Roe v. Wade, sort of outlawed abortion, and in some cases in more expansive ways than what we did. Ireland is a very religious country, and so there were lots of religion sort of arguments and connections, and abortion access was limited. Ultimately, a lot of people were advocating for that policy to not take place and to reverse some of those limitations. And it really wasn't happening. The policy streams weren't converging in the right kind of way to make that argument until we had a professional, and I say professional in the context of not a low-income citizen, a woman who was very middle to upper class, who was pregnant and ended up losing her child in utero, and ultimately had attempted to receive an abortion, but was turned away because at her status of pregnancy, she was past the point of a legal abortion. And ultimately, that woman suffered a very severe infection and ended up dying. And so there was a lot of push after this particular instance to encourage reproductive rights to be restored in Ireland, because we had a clear example of a focusing event, a really sudden attention-grabbing moment with the poor loss of this woman that really became a good example for why lack of access to reproductive rights can be problematic. And you can see this article, her heart was beating too, the woman who died after abortion bans. And so it just provides an example of a case where in a policy-making effort, it might take this focusing event for you to really have the moment to encourage change. You know, I'm not quite sure. I asked the question of you, what might be a focusing event for our proposed change in food pantry hours? Now, I'm not so sure what that would be. I mean, I was trying to hypothesize creatively, and I thought, you know, there is an increasing number of research relative to the connection between students who experience food insecurity and hunger and rates of depression, particularly those who are from pre-existing low-income families. And not just depression, but in some instances of suicide or self-harm. And so in trying to think of a focusing event that could really bring the effect of hunger on the agenda, you know, if we had an unfortunate case of a student who was co-experiencing food insecurity and hunger, and then also had a really severe mental health issue take place, whether that be suicide or otherwise, that might be the moment of a focusing event that really calls forward the need for policy change to improve student access to something like a food pantry. So sometimes you get lucky, although these events are not lucky events, but you get lucky as a policymaker in that some event takes place that really opens the door for people to pay attention and really start considering solutions to your policy initiative. Another important lesson to this step of agenda setting is how useful it can be to keep your foot on the gas. Just because you get on the agenda doesn't necessarily mean that you're going to stay on the agenda. As I've talked to you about the last few weeks, the legislative calendar resets every session. And in those resets, public support can increase and decrease and change over time. So it becomes really important to keep communicating with your advocates, to keep the interest after your policy maybe makes it on the agenda, so that if it doesn't make it on the current calendar, you still have enough support from your constituents to argue that there's a need for change. It isn't enough to just get it there and then give up and be hopeful that something will happen. One of the most longstanding examples of this sort of keeping your foot on the gas in the current landscape has been those advocating for gun control laws. So interestingly, in the example of providing a lot of support to an issue that has required a foot on the gas for a long time, you know, we can track the beginning of our conversations of gun control laws all the way back to the 1960s, when we started to see the emergence of these organized institutions sort of creating precautionary measures against mass shootings. From then, stretching through the 60s, the 70s, the 80s, we saw, you know, interest in the issue that brought forward in the early 90s, the Brady Act, which is what requires background checks and waiting periods before you can get access to firearms. And then not until 2016, we saw some campuses allowing concealed carry so that people could be more protective of their own rights when they were on the campus environment. And even here in 2023, we still have a number of gun control bills on the agenda, whether they be related to reckless discharge or gun ownership or illegal possession, whatever you may consider to be your cup of tea in the gun control conversation. We've really sort of been in an environment since the 1960s for almost 50 years where we're trying to push forward piece by piece towards a more purposeful effort with gun control. So it just has become an interesting topic to consider when you look at how policy efforts really have to be persistent over time. One of the interesting things that I thought I would point out in that graphic on the right is that, I mentioned that public support for issues can ebb and wane over time. And you can see that public support for gun control laws very much wanes and is diminished until we have an instance of a mass shooting or a shooting at a school. We see with Columbine, we see with Sandy Hook, we see with Parkland, that those lines were sort of, they weren't very dynamic. They were relatively stable. And in some case, support for laws was going down. And then all of a sudden we had this instance, and all of a sudden gun control laws and support for stricter laws increased dramatically. It's a great example of how you have to keep your foot on the gas, and sometimes it's a focusing event that can really bring forward interest in a policy change. Gun control is a great example of that. Step 3 in our path towards policy making is focus on actual policy formation. Now, I want to mention that your book goes about discussing creating policies through the guidepost of 5 different theoretical models that might help you understand how to put together your policy solution. Some of these are, I think, very rational and easy to understand, and others of them are more reflective of what really happens, which is often a bit more muddy and complex. So bear with me as I try to do my best in giving you an easy to understand way to sort of engage with these theoretical models that talk about how policies are actually made. Once we have the problem, once it's on the agenda, how do we get it there, right? How do we push it forward? Well, one of our first models is called the garbage can model. This is a model that is relatively irrational in nature, if I'm be honest with you. And it sort of says that, we start with all of these solutions to potential problems. Without the problem itself, we have lots of ideas of how to take care of these longstanding issues in our country or in our communities. And all potential policy solutions kind of sit together in a garbage can. That garbage can holds a bunch of other problems that are going on at the same time. It holds all of our decision makers. And then finally, at some point, some policymaker decides to reach their hand into this messy, overflowing garbage can and just pulls out some sort of solution to solve a policy problem. One that probably has been around for a while, that people may or may not be in support of, that they just feel like they want to have an initiative and they're going to reach their hand in and just take something. So the garbage can model says it's not particularly rational how the choice is made. There are a lot of potential choices all sitting in the can at the same time. And we're not really thinking, oh, there's a problem and here's a potential solution. We're just saying, it's time to solve something. So let's pop our hand in the garbage can and pick whatever it is that we can. So there are some cases where policy formation directly connects to somebody just sticking their hand in the policy garbage can and making a choice in that way. I think the most common method, the most common theoretical model that I see used for policy change is called the incrementalism model, partnered with this idea called punctuated equilibrium, which sounds complex, but they're both very easy to understand. Incrementalism says that we argue for policy change through really small steps. We start with very small ideas that only differ sort of minorly from the current policy. And we try our best to pass each small step so that policymakers become even more agreeable across political aisles. And eventually, hopefully, we get our full policy change implemented. So the more that we can think about the smaller steps of the ladder, the easier it is for us to climb up with the help of both political parties than it is to try to always argue for these great, big, huge, radical changes. And usually those are more agreeable to both parties. Now, occasionally, there can be times of what we call punctuated equilibrium. That's where certain stable periods of incremental policy are kind of broken up by a complete redirection. or a huge policy change that just sort of came out of nowhere. And you can think about the argument for reproductive rights in that way, that I don't think anybody saw the overturning of Roe v. Wade much on the agenda. And then all of a sudden, bam, we have this complete redirection in the fight for reproductive rights during that time. So things are usually pretty incremental, and every once in a while, you'll have some huge effort where all this stable incremental change can be interrupted by some complete redirection or huge change. So, I ask you to think about what would be some incremental steps that we could consider when making our sort of appeal to changing some of the policies at Cardinal Kitchen. Maybe instead of arguing that they need to be open every day of the week, we start by just asking them to be open one extra night a month. That's not a huge change, but maybe it's that small incremental change that will lead to a policy where there is more accessibility. One of the best examples of real world incrementalism comes from the world of marijuana legalization, which I think you all are pretty aware of, that our efforts towards marijuana legalization began back in the 1990s and have really stretched forward incrementally and gradually across the last 20 to almost 30 years. You can see in the graphic on the left in the timeline that California began the effort of marijuana legalization. And sort of every few years, we had a couple of additional states sort of bartering in until we had a kind of a big landslide of states starting in 2016, and the number continues to grow. To now the state of the US, where we have a large number of states who permit it recreationally and a number of them who permit only medically, with Indiana being sort of the minority in not permitting some consumption of marijuana legally. But it was very much an incremental process where it took small steps of a couple of states before we really had the rest of the country buy into the notion that it wasn't going to be as problematic of a policy change as some people had thought. So I think marijuana legalization is one great example of real world incrementalism in public health policy. Another policy sort of perspective that's worth noting is called systems theory. This really is focused on inputs and outputs of the environment where a policy and a problem take place. And in order for us to make a change to an existing policy or implement a new policy, we have to be really mindful of what goes in to the policy and what we're going to get out of the policy. If you want to think of like the policy as a machine, and you're going to have to put some things in that are going to lead to certain outcomes. And whether or not certain policies function well is often dependent on what the inputs are and if the outcomes are actually taking place. So if we were to apply this kind of thinking to our work with the campus food pantry, we might want to start to ask questions like, how do the current policies that we have reflect certain inputs? So I might ask a question like, how does the hours of the food pantry connect to the number of students? Currently, the primary staff for the food pantry are students. And so the policy relative to hours is probably connected to the input of the availability of the students who are able to staff the food pantry. So one method of thinking about a policy change might be to focus on how outcomes can be adjusted using different things put into the machine. What would happen if President Mearns was able to fund a permanent staff member, not a student, who was able to monitor and direct the work of the campus food pantry as their primary job? Then all of a sudden, the input isn't just the great work of the students, as you see on the right, but it's also a person's position. And in that, they might be able to input more time into the pantry, which could lead to an output of more availability. So that's a systems theory approach, is really thinking about what are we putting in, what are the outputs from that, and how might we change the inputs to have better outputs. The fourth model they discuss for policy formation is called institutionalism and sort of rational choice. I have to be honest that it's a little bit of a negative perspective, but it really is probably an honest one of the way the real world works. This perspective argues that most of the time we do things that are in line with the way that rules and routines and political legacies have done them as part of the institutions that they are located within. Sort of like we do things to keep the status quo and keep things as easy as we can. We know that we have institutions who end up shaping the dominant actors who influence our public policy, and these actors sort of engage in shaping their institutions to meet the goals of the policy. Now, I'll tell you that's usually done in self-interest of those parties who are the influencers, but it's often done rationally. It's not often done just because somebody wants things to be a little different. It's often done to keep things in line with a way that makes sense to a lot of people. So if that doesn't quite make sense to you, let me sort of quickly review a quick conversation I had about a month and a half ago with the Chief Sustainability Officer here on campus. I was chatting with her a bit about the work of the food pantry based upon my interest in seeing how well this was serving students. And I had asked her pretty openly, the food bank often distributes food to community members through mobile distributions. They'll load up a whole semi worth of food and they'll take it out into the community and give it away to anyone in need. And I had asked her why we hadn't had some similar type of mobile food distribution here on campus. Why doesn't Second Harvest bring their big semi over and give away food to students like they would to community members? And her conversation with me was one that was lent towards this idea of institutionalism. The way that students are fed on Ball State's campus is through the dining halls and purchase of dining hall points. And the way that things have operated for a very long time is the expectation that students will buy and make use of those points at university dining halls. Now, if we were to bring in a semi-truck of free food once a month to students, what does that entail? Students being less likely to make use of their dining hall points, buying less points, making use of their points less frequently. And so, to keep in line with the way that things have always been done, which is to keep students spending their money on campus food options, which is the policy that was set forward by the Board of Trustees, set forward by the president, who were shaping the way that things happen with food accessibility on this campus. It makes sense just to have this food pantry that's open every once in a while, to encourage people to use it sporadically rather than providing this more consistent access to food. That was a disheartening conversation, a bit, but it is a good example of institutionalism. Rationally, it makes sense. It's the way that all colleges operate, to sell points and have students make use of that at the dining hall courts on campuses, advocated by people who are just trying to keep things in line with the way they've always been done. So why shake up the pot if it doesn't need to be shaken? But there are some arguments that sometimes institutionalism isn't doing the best job at serving the constituents within a particular community. And I'm not so sure that this is a particularly good example of just keeping things the way that they are if there's a need to make a change. So I just thought that conversation was a good example to help you understand a bit more about this idea of keeping things similar in institutionalism. The last model that they discuss is called the elite mass model. This is a model that is, I think, the most disheartening of all five, but is one that is pretty commonly understood. And that's this notion that there are a small number of electives who we put into power, who create policy on our behalf, and kind of this top-down approach. Their assumption is that we as a people are apathetic and we don't know enough to do our best. And so it's their job at the congressional level, or it's their job as the Board of Trustees of people that we have actively elected to put into power to make choices for us because we trust that they are going to represent us in the best kind of way. So that is a representation of this elite mass model, that they're the elites who control the masses. Sometimes people akin that to questions of if our congressional parties are really representing the US population well. So you can see that we are a Congress that includes almost 3/4 men, and yet the US population is relatively equitable in the context of our gender dynamic. So we put people in power in this elite way to make choices on our behalf, but in some cases, we're putting people in power who aren't necessarily the most representative of the general population. But this model does say that that's the way that we operate, is we just do our best to elect people who are going to represent us so that we don't have to think too much and care enough to make policy changes. That's sort of the last of the policy formation theories. Step 4 in the process is a simple one. I'm not going to spend really any time on it. So once you come up with a way to get your policy put together, then you've got to get it adopted. And I'm not going to spend any time here because I already have. We've discussed across the last 2 weeks how to go about getting a policy adopted from our conversations on what turns something into a bill and who are the people that you would need to contact and what are the conversations you need to have in the policy adoption process. So I'm not going to rehash that, but say for this step, you'd be doing the work that we learned about the last 2 weeks. The next step is policy implementation. Implementation is once your policy has been passed, following up to make sure that the solution is implemented in a way that you envisioned. And I remind you that if it isn't envisioned in the way that you had thought it would be, you should definitely take to something like the Federal Register, where all those new policies are posted, and comment and let them know, hey, we wanted this policy, but this isn't how we envisioned it. This isn't how we saw it taking place. That is, of course, at the federal level, but there are all kinds of ways to comment in more localized ways when you see that a policy isn't going the way that it was supposed to. For example, in the 2020 legislative session here in Indiana, they actually enacted 2 new policies which require community school boards to allow for oral public comment when they're at an in-person school board meeting. They have to legally allow people who are there to talk about what's going on at the meeting. So if you feel like you wanted to pass a policy for some reform in health education within schools and it's not happening the way you thought, you are legally permitted to attend a school board meeting and they are required to hear your conversation. So my argument in policy implementation is always make sure that you're following up. And if something's not happening, comment and let people know that it isn't taking place the way that you had aimed. The last step is policy evaluation. And this is another step where I'm not going to say much because we're going to spend a lot more time on evaluation later in the semester. But of course, you need to be attending after it's implemented if things are working the way that you intended. If I was to allow more days for the Cardinal Kitchen to be open and have this permanent staff member who is running it, are students being better served? Are we seeing food insecurity rates decrease? Is it solving the problem? And in cases where your policy might not even be adopted, maybe another policy is, you'd still want to evaluate because that could give you support for making a change in the future. Maybe it isn't passed this year, but they passed something else that didn't work. And it gives you power to argue for change in the future. I argue you should always leave evaluation for yourself and not your opponents, because opponents can bias their viewpoints. So it's always purposeful for you to conduct your own evaluations of policy rather than just to wait for people who are against you to talk about whether or not you were successful, because then it can be honest and from your viewpoint. But we are going to talk about more tools on evaluating policy later in the semester, so we'll hold tight and get to this final step much later on in the game. So that's it, my friends. Enjoy this fun photo of Gabe from 4th of July a few years ago. As you end your time with me in this recorded lecture, I think I capped you at about an hour. I hope you enjoy your work with Dr. Bry on Thursday. Remember to bring work with you to class for the study guide or for your advocacy activity. If you're working on any assignments, let me know how I can help. Send me an email. I'm happy to reach out to you, even though I won't be around on campus. I will be back next Tuesday with all of you for our session with District Representative Kyle Pierce in Zoom. So please make sure you're not forgetting to post those questions. And I hope you all have a phenomenal week. And I look forward to seeing you when I return next Tuesday. Have a good one.